I just had a patient today say she hated the word trials. She wanted to be on a clinical study because embedded in the word trials is the word try, and she didn't want to be tried. She really wanted to have it done. But I think this has been really one of the big advances and that has moved this whole field forward. So you're going to say something, Dave?
Yeah, I think I wanted to bring up a little rejoinder to that, which begins in Scotland, of course, which was the understanding.
Lind?
Yeah, it's land. It's got land.
Oh.
Which was, of course, the understanding that cancer could be influenced by hormones, and that was discovered at the University of Glasgow in Scotland. Subsequently, these followers in the United States picked up the fact that you could actually use this to effect by taking out the ovaries and so forth. But that led in turn to clinical trials which showed that tamoxifen, the first anti-estrogen, and probably a drug that has saved more lives than nearly any, could reduce the recurrence rate of breast cancer by half, a statistic that just blew people's mind at the time. And Bernie Fisher, who you mentioned, was heavily involved in this work also. But that led also, I think, to the somewhat tragic realization that speaking as a cancer patient, there's a tendency to get overexcited about things that we've managed to do and forget the fact that there's an awful lot still to do. But in this particular case, it's always been very clear that if you have a large effect, like 50% of people, there's still 50% of the people who have the disease or in whom it recurs. So that's, I think, a tremendously important thing that was also has also been addressed by clinical trials, but it's a large amount of what we have to get into in the future. The people who don't respond, the people who have such side effects that we can't treat them well, and so forth.
So, David, if I can ask you a question, and Pat also, you were talking about your seminal work with tamoxifen and antidepressants and showing the metabolites that are different than drug-drug interactions. And you were also talking about coding, how some people get no pain relief, but they just get the side effects. One thing I've always wondered about is when we treat cancer, and testis cancer is a unique exception because we cure that disease, it's easy to produce a remission. Tumors shrink, symptoms get better, but most of the time the cancer comes back because the cancer cells become resistant. But the normal cells don't become resistant. If you're given drugs that lower the white blood count, it will lower the white blood count every single time you give the drug. Yet the cancer cell is able to develop resistance and the white cell doesn't. Do you have any thoughts on why that would be, either of you?
Well, I think obviously it's not just the individual, I'm not quite sure which way to put this right, but individual cancers are different. They are different. But individual people are different. You're referring really to the situation where someone might have a perfectly adequate initial therapy, but there are still cells left. And in the case of the cancer which I've got, that's definitely the case. I have a brain cancer which had a complete resection. The surgeon says it's gone, but in fact it's not gone. It's there in microscopic form in many, many places. So that's one possible reason that things come back. I think a second one is the one I referred to earlier, which is you haven't really treated it optimally because of some metabolic deficiency inherent in the person's genome. But I think that that means that one has to design programs, and here we have a program here that aims to exploit not only the characteristics of the tumor, but the characteristics of the patient. Put the two things together, and Pat Loehrer has really led the idea of a consumer-based report for a patient that would have a genetic component from the patient and a genetic component from their tumor, allowing not only the side effects, but the effects to be genetically determined pre-treatment. An amazing possibility. But really, to address your question directly, Larry, I think there's two things at least, but there are probably many, many more reasons cancer gets out of the way. Sometimes, I mean, one really obvious thing is you can't get it all surgically. You know? You think you've got it, but it's not. You haven't got it all.